if you see the alert that it's being recorded, that's why. So right now I'm going to be setting up the stream for Facebook. Everyone, again, thank you so much for joining us, and we will get started very shortly. I just have to get this set up. It usually takes a couple of seconds. So. All right, one moment. Thanks again, everyone, for joining us. I'm John Nelson with the Public Affairs team for Nuvance Health. I am just setting up the live stream real quick, and then we will get going with tonight's update. Thanks again. It's probably just going to be another few seconds. I have to punch lots of buttons to do this, so to make sure I'm doing it to the right thing. Okay. All right. Thanks again, everyone, for joining us this evening. Very happy to have you here. I'm going to turn everything over to Dr. Mark Herco now, so he'll get us started. Thank you so much.
Thank you, John, and good afternoon, everyone. Thank you all for joining us for today's community forum. As you know, these forums are an opportunity for us to provide our community with updates about Sharon Hospital and for our independent monitor, PYA, to report on the compliance with Nuvance Health's affiliation agreement with the Office of Health Strategy and the state of Connecticut. I want to start today's forum by sharing some exciting news that has occurred over the past month or so. If you would recall, in June earlier this year, Nuvance Health announced our plan to appoint unique leadership teams to each one of our hospitals, overseen by regional presidents. As part of this announcement, Christina McCulloch, a longtime leader here at Sharon Hospital, has been appointed Sharon Hospital's new president. Christina will lead a full-time leadership team, including Vice President of Medical Affairs, Dr. Mark Marshall, along with the new Chief Nursing Officer, a role we are currently working to fill. Christina and her leadership team will work closely with the recently announced Eastern Regional President, Sharon Adams, to help chart Sharon Hospital's path toward the future. Next slide, please. In addition, in other leadership news, our Chief Operating Officer, Carrie Eaton, is retiring at the end of this year. I'm happy to announce her successor, Michelle Robertson. Please join me in welcoming Michelle, and along with Sharon Adams, to our Sharon Hospital community, and in congratulating Christina McCulloch as she continues transitioning in her new role as president of Sharon Hospital. Michelle?
Thank you, Dr. Herco, and hello to all on the forum. I'm Michelle Robertson, the new Chief Operating Officer for Nuvance Health. As Dr. Herco noted, that Carrie Eaton is retiring at year's end. Very excited to be back in New England after serving in healthcare in both Texas and Tennessee. And tonight I'm looking forward to hearing your perspectives and to the bright future that we have planned for Sharon Hospital. Over to you, Christina.
Good evening, everyone. Thank you, Michelle, and thank you to Dr. Herco for the introductions this evening. And thank you to everyone for joining us tonight. So some of you may know, but I have been a member of the Sharon Hospital team for 8 years now in a couple of different roles. And I've been able to experience firsthand how truly special the hospital is. And I am very much looking forward to the future of Sharon Hospital, and very excited to be here tonight as the newly appointed leader. So here on the screen, you'll see our agenda for this evening's presentation. I'll start with some hospital updates that will include some awards, some of our quality performance, an update on our strategic and transformational plan for our hospital, an update on some of our community engagement activities, And then you'll hear a presentation on our health equity, diversion, and inclusion initiative. We'll then go into an update from our consultants, PYA, regarding our CON affiliation agreement. And then we'll finish with a question and answer session. So with that, we can move into the next slide, please. So I'm going to start with some awards and recognition this evening. This is probably one of my favorite slides of the presentation tonight, and that's because I have the opportunity to share with you the many faces of the people that make up our team here at the hospital. These are our frontline staff. We have many different ways of recognizing our teams, but our teams are the reason why we're able to maintain high quality, safe care here at the hospital. These are pictures from some of our celebrations that we've had over the prior months. We have Safety Star Awards that we give. These are to recognize staff for prioritizing safety in everything that they do. We have a Daisy Award, which is a really fun award because our patients nominate our nurses for a Daisy Award, and we're able to present this quarterly. And I'll just point out that one of our nurses in the pink shirt here, she was recognized by many patients. Her name is Lisa, and she received our most recent quarterly Daisy Award. We also, during Nurses Week in May each year, recognize a couple of our nurses at the state level, and they are recognized for the Nightingale Award. And this year we had Kristen and Ashley recognized for that award. And then we have many other awards that we give out, all recognizing the amazing staff that give the care to our community each and every day. Next slide, please. So this is another fun slide to share because these are some of our recognitions that we receive here at the hospital. Again, recognizing the care that we give. And right front and center, you'll see one that I think are most proud of, and that is our CMS 5-Star Award. This year, 2022, is our third consecutive year that we have received this highest quality rating from CMS, the Centers for Medicare and Medicaid. The rating scales on a scale of 1 star to 5-star. And again, this is our third year receiving the 5-star rating. We are one of 3 hospitals in the state of Connecticut to receive this rating. We also received in 2021 an award through a quality organization called Vizient, and this was a Quality Leadership Award, and it recognized Sharon Hospital for being a top performer in quality care based off of a group of hospitals like us, so small community hospitals. So again, another award that we're very proud of, and another high achievement for our team. We also received a Gold Plus Award from Get With The Guidelines through the American Heart Association. And this recognizes the care that we give to our stroke patients. We do have a nationally certified stroke certification program here at the hospital. And receiving the Gold Plus Award recognizes our teams for the care that we give, and it recognizes that the care is of high quality, meeting all of the standards set forth by the American Heart Association. So we're doing a lot of great work here in our small community hospital, all that we are very proud of. So this slide represents some of the initiatives and programs and groups that we have in place at our hospital today that allow us to achieve some of those awards and allow us to continue to provide high quality care. And I want to take mention to some of those. Our emergency department. Our emergency department is one of the doors to our hospital, probably the main door to our hospital, right? Our patients visit us through our emergency room for emergent care and other reasons, and we are open 365 days a year, so very easily accessible. We have been here throughout the COVID pandemic and have stayed up to date on preventative treatments, testing, and up-to-date procedures as it relates to COVID-19. Just a few days ago, the White House declared a national emergency for monkeypox. So we are now working diligently to ensure that we are up to date on monkeypox preventions and treatments and testing so that we can be here for our community as it relates to that. and other new emerging needs. There have been many capital investments for our hospital since we've been Nuvance Health, totaling up to $14 million. Some of those investments include 3D mammography, been able to upgrade our mammography and increase our capacity for mammograms. We have a new updated MRI unit, again, and we've been able to increase capacity and accessibility to MRI services here. And that's all because of the capital investments that we have gotten through, as being a part of Nuvance Health, that's made that possible. We have many support groups, some for stroke recovery. We have arthritis exercise programs. We have joint camp for our patients that are about to undergo a joint replacement surgery to ensure that they are ready and prepared post-surgery. And we have support groups following those procedures. And this is just a sample of the many services that we offer here at the hospital. Next, I'll give you an update on our growth-based transformational plan and some of the regulatory updates surrounding that plan. You may remember that last year, at the end of 2021, we announced our strategic plan for the hospital that was really based on us transforming to meet the needs of our community, transforming to the ever-changing landscape of healthcare, right? And it's been really challenging for rural hospitals across the nation. And it's necessary for us to be agile and adapt with the end goal of being here for many years to come. Our plan included expanding access to primary care, access to specialty providers, and access to wraparound services, so your basic needs that you may come to the hospital for. It also included consolidation of some services, and that's really to be up to date with standard of care and practice in medicine, and also in determining how to best utilize the space that's within our hospital to meet the needs of our patients. And a part of that plan also did include phasing out labor and delivery services based on an underutilized labor and delivery service line with the goal of investing into services that meet the needs of our community. So here are a few updates. We've been working really diligently on executing many parts of that plan, and I'm pleased to share some of these exciting updates with you here tonight. We have hired a new primary care physician, and this is something that we've put a lot of work into, and I'll share some more a little bit later in the presentation about some of those recruitment efforts. But last year, we were able to share that we hired 2 new nurse practitioners to join the primary care team, and now we're able to share that we have hired a new primary care physician. So a total of 3 providers in the time period of a year. And we're really looking forward to this new provider. We'll have some more details to share in the upcoming weeks. We have initiated a Tele-Health Kiosk. And this Tele-Health Kiosk is access for our Sharon community to specialty providers. It's virtual medicine. So we have a machine that is in our general surgery office. It's located in one of the exam rooms, and it's easy access for any patient to receive an appointment with a neurologist, an oncologist, or an infectious disease doctor very immediately as needed. This is one step in our plan to increase specialty care here at Sharon Hospital. As we continue to work on recruiting specialty care doctors, the goal is to have doctors rotate here at the hospital so you can not only access specialists through a kiosk virtually, but here on site. Recruitment is a part of everything that we do every day, and we are most often looking and recruiting for staff in many of our clinical and non-clinical departments that keep our hospital running each and every day. We also have some new positions that I wanted to share with you this evening. The first is our Chief Nursing Officer. So we are recruiting for a full-time Chief Nursing Officer that will be dedicated to Sharon Hospital and be a part of our executive leadership team here. We have a new, not a new role, but a role that we're recruiting into for an EMS coordinator. And this EMS coordinator is critical for connecting our EMS community with everything that we're doing here in the hospital. So we are in the final stages of recruiting for that EMS coordinator. We'll be able to announce that soon. We have a new position of a women's health coordinator. This is a position that was developed as part of our efforts to develop our women's health service line to treat patients, women, across the lifespan. The role of this coordinator will act as a liaison for our patients, our providers, the services in our community, and some services that may be available outside of our community. So this is a newly created position that we're currently recruiting for. And then our hospitalists. Our hospitalists are our providers that take care of our patients that are admitted as inpatients in our hospital. And we are looking to add hospitalists to our team, in addition to the one full-time hospitalist that just joined our team last week. We do have two parts of our transformational plan that are in the midst of a regulatory process. And I'll start with labor and delivery. We did complete an application to phase out our labor and delivery services. That application has been deemed by the Office of Health Strategy as complete. And the next phase of that process will be a public hearing. And the public hearing is one of the final stages in that regulatory process before a decision is rendered. The next application that we filed is an application to consolidate our inpatient units into one progressive care unit. And what this essentially means is we have two main inpatient units inside of our hospital, and they both have space that's underutilized. We'd like to take the care that we give in both of those units and combine them into one unit. And based off of the patient population and the types of patients that we care for in that unit, the most appropriate level of care is progressive care. So our goal is to provide the vast majority of the services we provide today. That includes ventilator capability, telemetry, or heart monitoring. We'll do all of that with the same staff, the same equipment in a new location. So that application has been submitted. We are in the middle of what they call the completeness questions part of that application. There are some clarifying questions that are asked. We are in the middle of responding to those. And then once those completeness questions are finished, the application will be deemed complete, similar to labor and delivery, and that will have its own separate public hearing. So that's where we are in the regulatory process with those certificate of need applications. Community engagement. So community engagement and two-way communication is a priority for us. On the next slide, you'll see that there are many different ways that we've been communicating and listening to our community as it relates to updates within the hospital. These are just some of the examples, but we've been on radio, and we continue to be on radio. We host community roundtables that are open to anyone to come and hear our updates and to ask questions. Letters to the editor. We've attended many different forums in the community, and we have some lectures that we've hosted. All of our communication efforts and forums can be found on our website, which is where we keep all updates related to our transformational plan. And you'll see here at the bottom of the slide is our website, and I'll read it to some of you that may not be able to view the slide. It's nuvancehealth.org/Sharon Hospital transformation. These images are images of a couple of the videos that you'll see if you do access our transformational website. These are great videos because it'll give you an opportunity to meet some of our staff. These are two of our wonderful providers that have been with us at Sharon Hospital for a while. And if you've received care here, you may recognize them. Dr. J.C. Jimenez is one of our hospitalists, and Dr. Ron Santos is the chairman of our emergency department. And he also works in our emergency room, so you may have seen him if you've come in But I encourage you to visit our website, check out all of our updates, watch some of the videos so you can get a little bit of insight on what it is they do and what they love about Sharon Hospital. I next want to thank you. Thank you for your support, because we are here as a hospital for you. We are here to meet the needs of our community, and we wouldn't be here without your support, without you accessing our services. These are just a couple of examples of ways that our staff have been recognized from patients publicly, and it means so much when this happens. It makes everything that we do worthwhile. And I'll summarize with one of our patients here in quotes said, "Heroes don't always wear capes." And isn't that true, right? And mostly everyone that works in our hospital is a hero, and we're so grateful and thankful that they're a part of our team. But we truly are all thankful that you support our hospital. So thank you for that. So next, we're going to share with you a recruitment video. And this video was spearheaded by our Sharon Hospital Board of Directors Recruitment Subcommittee, which was a group that was designed, it was created and comprised of community members to focus on how do we recruit clinicians to our area. We're rural, it can be a very difficult area to recruit to. So this video was put together to assist in that process. And we're going to play it for you in just a minute. It's only a couple of minutes long, but I think it will resonate with you as it resonated with me. It's very touching about our Sharon community. Next, please.
Where will your career take you?
We have the top-rated Sharon Hospital. Hi, I'm Liam Neeson. I'd like to invite you to consider making Sharon, Connecticut, your new home.
Hi, I'm Meryl Streep. I'm a longtime resident of the northwest corner of Connecticut, where our Sharon Hospital is located. We've raised 4 kids up there. We were a part of the hospital community. We were in there a lot, that's for sure.
Our region needs talented clinicians who can bring their skills to Sharon Hospital.
You work hard to improve others' lives, but what about yours?
I think this is a great balance between work and life. Come on in, let me show you around. When I first went into medicine, this is the type of medicine I wanted to practice.
We have state-of-the-art equipment. This is a hospital that values leadership input from the physicians. You want to be able to get up in the morning and go to a job you want to go to every morning.
There's a great sense of gratitude, and I think that's what keeps me motivated every day to come to work. It basically is welcoming for every walk of life.
The region holds great charm. It's a special place where I've raised my own family.
You get to know each other in a community like this. It's a beautiful place to live and to raise kids. Fantastic public schools, prestigious private schools. There's the Appalachian Trail. There's an active conservation for farmland. There are huge opportunities for cultural enjoyment.
Being the father of 2, you can have any winter sports that you want. In the summer, we have so many ponds and lakes and close to the shore.
Tons of hiking, mountain biking. Again, being able to go out there and just enjoy the fresh air. This place is actually very unique.
Sharon Hospital is a community within a community. We treat each other like family. We all care about each other. The patients who come in here actually will receive that personalized care, that tailored service to them.
Sharon was awarded 5-star rating by CMS, and that's something to be very proud of.
I think this has been a 5-star and more for my family.
It was the best professional decision I've made. I love Sharon Hospital.
Come and explore the region and discover the many reasons to make Northwest Connecticut a wonderful place to practice and to live.
Where you can pursue opportunities and make lifelong connections.
I highly recommend the Sharon Hospital. It's a fantastic place. I know a lot of the people that work there, and I hope you might consider coming to our community. I know you won't regret it.
Picture yourself here.
Great, so I hope you enjoyed the video. And just a reminder, if you'd like to view that or any of the other material, to visit our transformational website. I'll next turn the presentation over to Ildi, who's a member of our team on Nuvance Health, and she's going to discuss our health equity, diversion, and inclusion initiative here at Nuvance Health in Sharon Hospital. Welcome, Ildi. Ildi, are you there? Okay, I apologize. We might be having some technical difficulty with getting Ildi off of mute here. There you are. So we're not, Ildi, we can't hear you.
Christina, why don't we move on to PYA and we can come back to Ildi if she figures it out. Ildi, if you would like to sign off and sign back on and just let me know when you're back on and we'll come back to your part of the presentation if that's okay. Okay,
Perfect. Thank you.
So I will, I'll move the slides forward to the next section.
Fantastic. And this is David McMillan, and I guess I'll jump in here and we'll do the affiliation update. Appreciate everybody taking an opportunity to participate tonight. If you could go ahead and advance one slide, please. Go ahead and advance one more, please, if you don't mind. Here's what we're going to cover tonight. We're going to start by talking about our roles and our duties as the independent monitor. We'll talk about this 6th period report and what the timeline has been for those purposes and those processes. We'll, of course, spend the majority of our time going through conditions findings relevant to this particular period. Talk about what comes next, and then, of course, John is available to receive your questions about our presentation or any part of tonight's presentation. Should you direct any questions to us, we'll be prepared to answer those tonight. So let's talk first about our role. This slide sort of highlights that, but I'd like to maybe stop and give a little color to this. Certainly, we report to the Office of Health Strategy, and so while Nuvance actually funds the role of the independent monitor, all of our reporting is to the Office of Health Strategy. That is the relationship that we have an obligation to, and our role is to remain independent with respect to Nuvance itself. Now, what we're limited to is monitoring Nuvance's compliance with the conditions set forth in the agreed settlement. Now, the agreed settlement is a document that's publicly available. We reference it throughout our report. We reference the conditions contained therein. With that being said, it's important to note that as we meet tonight, we are aware that there has been ongoing conversation between Nuvance, the state of Connecticut, and some members of the Sharon community about certain questions that have been raised regarding compliance. We are aware of that information. That is not information that we have any purview over which to rule or comment on. If the state in its determination makes a change to the agreed settlement, or if the state comes out with some sort of information that we as the independent monitor either we're not privy to or need to be made aware of with respect to our evaluation of compliance, then we will then at that point be reporting upon any of that information. So I do want the group to know that while there is ongoing dialogue continually, certainly between Nuvance and the state with respect to items of compliance and information requested, reporting requirements. You'll not find within our report, if you go and pull that down publicly, any references to the ongoing investigation that the state had launched back in February with respect to certain questions, simply because it's not complete and there's nothing for us to report on at this point in time. So we'll be happy to answer any questions about that, but wanted to make sure that folks are aware of that. One other thing I want you to be aware of is that as monitors, we do not have any responsibility, and nor is it appropriate for us to editorialize about our opinions or perspectives with respect to the information provided. Our responsibility is to review information as it relates specifically to the settlement terms and to determine compliance with those terms. Oftentimes, that's a yes/no question. There are certain terms within which there is some room for interpretation. We talk with the state when we have a question about what that might mean. We follow up with Nuvance if we need additional information in that regard. But that is, again, an ongoing dialogue. But I did want the community to understand, certainly as professionals, we all have opinions about matters, but that is not our responsibility to express an opinion. Our responsibility is to make certain that the objectivity associated with these agreed terms and conditions are being evaluated in a fair way, and that information is being challenged appropriately to ensure that the information provided is relevant, correct to the agreed upon settlement. So we work hard to maintain that objectivity and to ensure that that any perspectives or opinions we may have as individuals aren't reflected in that, but that instead we're being true to the spirit of the agreement, which is to simply monitor compliance. As mentioned, every time we were retained for a period of 5 years, the state actually has an option to shorten that to a 3-year period. At this point, we've not heard anything from the state with respect to that term. So as we sit here today, we are still engaged under a 5-year term. If you go ahead and advance to the next slide. So there are a number of things that we do in order to monitor that compliance. We initially conducted a number of on-site visits. The onset of COVID resulted in changes, as you might imagine, to many of the processes in order to maintain health and safety. We have continued since the onset of COVID to conduct most of our visits virtually. We do look forward to the time where we can come back on site at each of the facilities, actually meet face-to-face with folks again. We're hopeful that will be sometime here in the near future. We do coordinate all of that, not only through Nuvance, being respectful of what their conditions are at the individual facilities and what their policies and procedures are, but also with OHS in that regard. We certainly have to furnish a written report, which has been done for the 6th period. We do meet with the representatives, as mentioned here in step 3, and we'll talk about that more in the conditions in just a moment. We participate certainly in these public forums, and then we do make reference to anything that could be out of compliance, and we document that, and we have a responsibility to actually coordinate conversations between Nuvance and the state to get to any corrective action that's necessary. So those are sort of our duties as outlined by OHS to us. And now we'll flip the slide. We'll go ahead and begin thinking about what the 6th period looked like. The periods occur in semi-annual increments, and so these are 6-month periods. They end at the end of if you think of a calendar year, they end at the end of the 1st quarter of each calendar year and the 3rd quarter of each calendar year. It just so happens that 3rd quarter ending of each calendar year corresponds also with Nuvance's fiscal year, which is a 9/30 fiscal year. So as we sit and think about our time today for this 6th period report, you can see the timeline here and the times that were covered. beginning back in the fall of 21 and advancing, of course, through March 31st. Then what has happened since March 31st to produce the report and present this to you tonight. Let's go ahead and flip the slide. So our report has detailed information surrounding each of these conditions. It defines the condition itself, pulled straight from the agreed upon settlement. It refers to what we evaluated in order to make a finding on the condition. It outlines Nuvance's approach for meeting the condition as well. And so what you'll notice when you look down the right-hand column for our 6th period, we deem Nuvance to be in compliance with each of these conditions. I don't want to overemphasize what I'm about to say, but I do want to acknowledge for those folks who may be listening that we're aware that there are those in the community who have questioned compliance in certain areas and are communicating with the state about that. We'll, again, as I mentioned earlier, continue to monitor that, but the information that we have reviewed to this point continues to indicate compliance. So I want to go through those relatively quickly. I'll stop on a couple of them and provide some color commentary, and again, we'll be available to answer your questions. The first two, first one doesn't relate necessarily to Sharon. It's primarily to Danbury and Norwalk. As it relates to Sharon, there is a condition that speaks specifically to the board composition and what has to be the criteria for selecting board members on that community board. And you can see that we looked at all of those resumes and understood those members to come from the community. There is a responsibility in condition 3 for the system to provide joint board meetings, which again, those dates are listed in our report if you have questions as to when that occurred. We deem based on the information that we reviewed and that was provided to us that's in compliance. Number 4, again, is a relatively objective condition having to do with the very important role of providing culturally and linguistically appropriate services. There's been a lot of work done by the system on this since the merger. We've had the opportunity to review quite a bit of information regarding the execution plan behind this particular initiative and evaluate those tactics against the agreed upon settlement. Again, we deem that those activities are in compliance with the agreed upon settlement. Number 5 is an interesting condition in that it is a relatively short condition that actually has about 4 or 5 sort of tests within it. If you sort of break the condition down into its component parts, you'll see that there is it's kind of a 4-part test as it relates to number 5. The first is, maintain or adhere to a current charity care and indigent care policy after closing, or adopt new policy. So that's kind of a 2-part test. As we reported in previous reports, Nuvance has adopted a new policy across the system. That policy was implemented in July of 21. Prior to the implementation of that policy, we, along with others, reviewed the policy. We reviewed the policy kind of with respect to the 3rd test embedded within this condition 5, which is whether that policy as written created a policy that was at least as generous to the community as the policy that predated that change. Again, we reviewed that policy that went into effect and deemed that it was in fact at least as generous as written. And then not listed here on this page, but embedded within the condition is it has to be in compliance with state federal regulations, which we also evaluated the new policy for. What I will say tonight is that as we begin to have available to us information from reporting periods after the implementation of the new policy in July 21. So if you think about annual reporting periods, that would mean the 21 fiscal year, which ended September 30th, which would only contain 3 months of information from the new charity care policy. Certainly a better, more comprehensive measurement will be the fiscal year ended 9/30/22, which will have a full 12 months of information contained after the implementation of the new policy. We will then be able to objectively test what we opined upon or agreed upon earlier, which is that the policy was written in a manner in which it was as generous to the community. There will be the ability to test that more objectively as more time passes and we're able to evaluate the actual charity care and indigent care results once that policy was implemented. So you can look forward to that in the future, and we'll be gathering that information as we go. Moving forward, condition 11, we talked about the on-site visits being on-site/virtual visits, and there are a number of those that are cited within the report for your reference over the course of the 6-month period. Similarly, tonight's public forum and other public forums previous to this that we've participated in are basically in compliance with condition 12B. Condition 15 speaks to a number of efficiencies from a cost saving standpoint that were contemplated and quite frankly expected by the state in its review and approval of the agreed upon settlement. As a matter of just sort of observation, part of what any consolidation is intended to do is create a more efficient care delivery system. Efficiency can come in many different forms. Sometimes it's in cost savings, sometimes it's just in the ability to do something better and quicker. But in this instance, there were some specific estimates of cost savings that had been provided by Nuvance prior to the closing of the transaction. The state then required in condition 15 for reporting on actual results compared to those forecasts. In our report, we note that in most all cases, Nuvance has fallen short of those projected cost savings that were in the original agreed upon terms and settlements document. In such a case, what the agreed upon settlement requires is that Nuvance provide explanation for those differentials, which it has done in each of those instances where it has reported results that differ from those projections. And in that regard, they are in compliance with condition 15 by not only providing the reports themselves, but also providing any explanation for those variances. And so we'll continue to monitor that with each subsequent semi-annual period, evaluating the information provided by Nuvance. Condition 18 is a condition that is actually, and I'm looking over here at my actual condition language, but this is a condition that specifically relates to obstetric and gynecology staffing, both at or at all three at the hospitals that are subject to the agreed settlement, Danbury, Norwalk, and Sharon. But then there are some specific requirements as it relates to Sharon, specifically that the hospital medical staff have at least 2 full-time equivalent OBGYN physicians. It doesn't say it has to be 2 people, but just 2 FTEs. So it can be any number of that provide obstetrical services at Sharon Hospital. This is one of those places where there's some room for interpretation where it says subject to availability of appropriate physicians and community need, and a few other things. What we, PYA, do each year is we review the medical staff logs to make sure that the roster itself includes sufficient OBGYN resources to meet this requirement. We also go further to understand what access the community members have available to those particular OBGYN medical staff members, whether they're seeing patients in the community and taking new patients within the community, what appointment times or appointment windows are available to patients in the community, to evaluate whether or not there is access, the provision of at least 2 full-time equivalent OBGYN physicians. And again, that's sort of what we can evaluate. Is there, are there 2? What we can say for the period ended 3/31/22 is yes, the system met the requirement to ensure there are 2 full-time equivalent OBGYN physicians available to provide OB services within at Sharon Hospital. And so you can see the yes there. We also make note, however, in our report that we are aware of the announcement that has been made that was referenced earlier in this presentation to phase out, terminate, suspend, pick your term of choice, labor and delivery services. We understand, and as has been discussed earlier in this presentation, that the certificate of need application for the cessation of those services has been deemed complete by the state, but that the state has not yet reached a conclusion on that. Therefore, until such time that the state does grant Nuvance and Sharon Hospital, if they choose to do so, the ability to cease providing those services, then we will continue to evaluate performance relative to this particular agreed upon settlement term. And the other thing that could change that is if the state comes and for some reason amends the agreed upon settlement term to some other measurement. But until such time, all we can do is reference this. I will say that there is a condition that is not reported upon in the 6th period report that is required annually. We will be reporting on it again in the 7th period report, and that's condition 16. Within condition 16, there are a number of things that we evaluate, but one of which are defined services that are required to be maintained at the hospitals. Two of those required services were mentioned here tonight. One is labor and delivery services. Again, that's sort of the overlap with, we understand the announcement's been made. We understand the certificate of need is still pending. It's deemed complete, but the resolution is pending. The other one, the condition 16 specifically refers to is critical care, as was discussed earlier tonight. The critical care, the provision of critical care is not ceasing. How the critical care services are provided is being evaluated to provide that in a different model. And I would for community members listening, if I'm reading directly from the CON application at this point, a statement within the proposal that Sharon Hospital will continue to provide the same level of care currently provided to patients at the hospital. So there's something from our perspective until such time that there's a ruling on that, similar to the OBGYN and the labor and delivery services. We cannot measure anything other than the ability and the evaluation of the disposition of those certificates of needs. Moving on to 20, there are a lot of requirements in condition 20 about quality and performance data that the hospital or the health system provided, and specific to the hospital. Heard a little bit of that in reference to the 5-star earlier tonight. And then various other integration activities are contemplated in condition 21. Again, there are a number of matters in condition 21 that you can reference either in the agreed upon settlement or within our report. And again, in each of those instances, whatever those reporting requirements on those integration initiatives are, Nuvance complied with those. And so that's a quick summary, somewhat quick summary of our evaluation of the terms and conditions that were applicable to the 6th reporting period. You wouldn't mind turning the page to the next slide. So There are a number of things that we'll continue to monitor. I've mentioned all of those, dialogue between the state and certain community members here in Sharon, and the announcement by the state that they were looking into some of those issues. Certainly these two certificates of need that have already been referenced tonight with respect to critical care and to labor and delivery. We will continue our regular check-ins with Nuvance and with the Office of Health Strategy. We're planning our on-site and/or virtual visits for the 7th semi-annual period report now. And again, we're hopeful that soon we'll be able to do that in person. And then, of course, we'll be back and once the 7th period report is available to attend the public forum. So if you need to contact us, which some of you have taken the opportunity to do, we absolutely encourage you to do so. Our contact information has been provided before, or we're happy, and anyone at Nuvance can provide it if you're not aware of it. If you wouldn't mind to go ahead and flip the slide, John, to the next one. If there's anything that we can help you with and talking with you about, then we're happy to do so, and answer any questions you have about our report or the process we go through in producing it. So, John, that's our report for this 6th period. If there are any questions that come through, we'll be available to answer those.
Thanks, David. Ildi, are you on? Can we test and see if you are available to come and talk in video now? Can you unmute yourself and see if you're available? We've been, obviously, as you can tell, technology is very fickle, and sometimes it doesn't work for people. So I don't necessarily know. She is on, but we can't seem to see her or hear her tonight for some reason.
Hey, John, just for reference, I can see Ildi, I just can't hear her.
Yeah, I think she's having some microphone issues. So for that reason, we're disappointed that we're unable to talk a little bit about the role that Ildi has started to perform for our health system, which is that of health equity, diversity, and inclusion. But we will make sure that we schedule her some time for the next forum, because we definitely think she is someone that you would like to hear from. We will now get to the Q&A part. This forum follows the same format as we have done with all the other forums. If you have a question, we invite you to type it into the Q&A or the chat function, and we will make sure that we get everyone back on now. So what I'm going to do is, if our panel could turn your cameras back on, and I will stop sharing the presentation, and then that way you can see everyone who's here, and we will answer some questions for you. So as you can see, you met David. Dr. Herco's here. Dr. Marshall, I don't know if you want to introduce yourself, since you didn't really speak yet. If you want to let everybody know who you are. And
sure, yeah. Mark Marshall. I'm the Vice President of Medical Affairs. I've been a physician at Sharon Hospital for about 23 years as a hospitalist and as a palliative medicine specialist. So I appreciate your attention tonight.
Excellent, thank you. And Dwight, did you want to introduce yourself?
Sure, thanks, John. Hello, everyone. My name is Dwight Tarwater, helping out with as the independent monitor and manager at PYA, just supporting David with our mission. Good to see everyone.
Excellent. So now's the time. We're all here. If anyone has any questions, please type them into the Q&A. I don't see any questions yet, or the chat. I'm pretty sure I should have everything turned on, so you're able to do that if you have them. We're happy to answer any questions that you may have. It's a quiet group this evening. I think we were expecting to have a few questions. Okay. Christina, did you want to offer any any, I don't know, I don't want to say vamp, or if you want to, like,
John,
offer
could
any
I-
additional thoughts. Go ahead.
Can I make a suggestion? Can somebody from the group at least put something in the chat so that we know that the chat function is working?
Okay, let me, she says the chat isn't working, so let me see if I can figure that out. My apologies on that.
There are, so in the Q&A, there is a message that says the chat is disabled. The only format where they can submit questions is through the Q&A, and there are a couple of test questions in there too. So the Q&A is the appropriate place to put the questions.
Yeah,
not the
so apologies for directing everyone to go to the Q&A, and I'll look into the chat. I don't understand why that's not working. So if there are any questions, please chat them in there, and I will see if I can figure out what's going on with the chat. Yeah, I don't understand. There's some sort of technical difficulty tonight because I don't see anything that says chat is turned off. So apologies, everyone. I thought I was the expert at this, but clearly I'm not.
But the Q&A function is working.
It is. All right, so here we have a question. How will a new EMS coordinator support local EMS?
I can take that question. So the role of the EMS coordinator is to really act as a liaison between the hospital and the EMS community, and ways in which EMS is supported are education, chiefs meetings, and it's just enhancing communication in between the two parties.
Okay, thank you. This is a question with regard to hospital staff recruitment. What is Nuvance Health doing within the community to promote affordable housing in the area? Not sure if anyone. Go ahead.
So Sharon Hospital is partnered with our community partners. We feel that affordable housing is a priority. And while that responsibility doesn't rest solely on the shoulders of the hospital community, we support this initiative, and we are willing to work with members of our community as we look to have available housing for our staff.
Okay, thank you. And I really do apologize with the chat. I don't understand why that's not working, but I'm going to stop looking and trying to fix it. If people could just ask in the Q&A, that would be appreciated. If there are any other questions.
I just want to add to the affordable housing question is that's a really important topic for our community and for a lot of the communities in Connecticut. And I think that, there's a lot of potential. And I think we need to sort of get together with our neighbors and our elected officials and make some progress with affordable housing, not just for recruitment to the hospital, but just in general for our community.
And everyone, I think I was able to fix the chat there. So I don't know if it'll work now for you, but please feel free to type into the chat if that's where you feel more comfortable asking a question. Didn't take me that long, right? Sorry about that, everyone. So another question here. Hi, Larry Moskowitz, RN. I am on the Affordable Housing Committee and look forward to Nuvance Health helping us support this concept. That's just a statement from him. And then Kathleen asks, please describe the full range of services Nuvance Health envisions for Sharon Hospital's Women's Center.
Sure. So, hi, Larry. Thank you. We look forward to working with you as well. I can take the question related to our vision for women's health. when we look at women's health, we look at women's health across the lifespan, right? Today, currently, we do offer a vast variety of services here at the hospital, and that does include preventative care, wellness care, as well as disease management. What we are in the midst of doing right now is evaluating those services that we currently provide, and then looking at some of those services that we don't, such as GYN oncology. We don't have a GYN oncologist readily available for our teams here. So part of our discussions are, how do we do that moving forward? How do we bring that specialty care here to our Sharon community? So that's where we are now. We're doing a gap analysis, looking at those services we have. We want to maintain those services outside of delivering babies. All of the other services that we provide today, we anticipate providing in the future, in addition to more.
Okay, thank you very much. We'll give it a few more seconds, see if anyone else has any other questions. We don't want to leave you hanging, but we do appreciate everyone joining us this evening on what is a warm New England evening. Okay. Wait, here we go. This is a question for David from Lydia Moore. She says, thank you so much for your thoughtful presentation tonight. She's trying to respectfully understand the role of the independent monitor. If you aren't able to address what is currently happening with Nuvance Health, going against the intent of the agreed settlement, even if OHS was to rule that Nuvance was to keep the maternity unit open, I'm concerned that the damage will already have been done and that your response will be too late.
Hi, Lydia. Thanks for the question and the comment. And I know this is a sensitive subject for a lot of communities all over the country that have faced difficulties with respect to service disruption, with service being suspended, whether that's labor and delivery or any other service. So I understand just from my own experience working with in healthcare throughout the country, exactly sort of the angst around this particular issue. And I cannot obviously speak to any of the decisions while they were made from a strategy or other standpoint. I can only observe what has been done. To your question about the intent of the agreed upon settlement, I think that question in and of itself infers the fact that perhaps the intent was to prevent any disruption of service ever within the communities, and that may well have been the case. But what the settlement didn't do was prevent Nuvance or any other provider from acting in a manner that is consistent with other state policy and procedure. So I can't certainly speak to how or if there were discussions other than what's documented in the agreed upon settlement about how that would occur. But what I can assure you, Lydia and others, is that there's been a lot of dialogue between us and the state on this particular issue, just with respect to our role on the agreed upon settlement and reporting on it. There is not a role for us to look at compliance outside of, like I said, the actual documentation within that, which is the service being provided during the semi-annual period. And so while I have a big heart for exactly what you're asking with respect to the community and its access to services, I can't comment about how the state might or might not have anticipated Nuvance or any provider, including physicians who are subject to those terms and conditions, how they might have envisioned the process to go other than what's happened to this point. So it's not a satisfying answer, I'm sure, for you, Lydia, and I apologize that I'm not able to give one. It's just not within my purview to be able to do so. If it's okay, John, I'll just read this follow-up question.
Sure.
Follow-up question from Lydia. Have you spoken with OHS regarding the possibility of them updating the agreed settlement? And your experience, has that happened in the past? I can't speak to whether that's happened. We'll take it in reverse order if that's okay, Lydia. I can't speak to whether it's happened in the past, often with OHS. What I can tell you is that our experience with other similar types of settlements between various state agencies, sometimes it's not the Connecticut calls it the Office of Health Strategy. Other states use different state offices for compliance measurement. But what I can tell you is that most of these documents are living, breathing documents. And there is generally a process by which they have to be changed, but that it is not at all uncommon for the agreements themselves to be changed. Now, again, that's speaking in generalities. Whether or not the state of Connecticut has been active in that sort of dynamic, sort of evolutionary process as it relates to their documents. You can do a little research and see if I can find episodes or specific instances of that. If there's someone else on the panel that knows of that, please feel free to speak up. But with respect to the first part of your question, which is whether I've spoken with OHS regarding the possibility of them updating the agreed settlement, what I can tell you is that with OHS, we speak often as we're commenting and talking about the agreed settlement terms and conditions as to whether or not they're still relevant for specific circumstances. For example, all of these agreements across the country are being evaluated in a post-COVID environment, and there's no such thing as a post-COVID environment. Let's say sort of the post, onset of the pandemic environment. To say, are they still relevant? Is there something that we need to do differently? So we've had a number of conversations with the state with respect to, is there anything that needs to change from a relevancy standpoint within that document? And if so, if they ask our perspective, we'll offer that from, as a firm with professional experience for their consideration. I'm not at liberty necessarily to disclose what any of those are, but I do feel confident saying this. The issue that you're addressing with respect to the change in services has been a topic of conversation very often between us and OHS. To this point, no suggested changes have come forth from OHS to us, not to say that they haven't happened elsewhere, and certainly will be prepared at the request of our client, OHS, if they ask us to offer our perspective from a professional capacity.
Thanks, David. We will go back to, and Lydia says thank you very much as well.
Thank you, Lydia.
We'll go back to, I'll turn this to Christina. Noah writes, the pandemic has caused new families and parents to move to Sharon and the surrounding areas. Has Nuvance Health considered these demographic changes? It seems this could possibly change the calculation to close labor and delivery.
So thank you for that question. Just as we have watched the demographic trends historically, we do continue to watch those trends and how they affect our community. And while we understand there have been some families that have moved to our community post-pandemic, it is not nearly enough volume that would drastically change our strategic plan.
Thank you very much, Christina. Okay, we'll give a quick last call. If there are any other questions tonight. We do really appreciate everyone joining us and giving us this opportunity to update you on what's happening. Christina, any parting words?
Yes, I do want to take a minute to thank David and Dwight for joining us this evening. And Ildi, although we had some technical difficulties, we'll be sure to hear your presentation at the next forum. And thank you to all of our community members for joining. I hope that this presentation was helpful for you and you learned of some new developments as it relates to our hospital. And again, thank you for supporting us here at Sharon Hospital. I hope you have a good evening.
Thanks, everyone. Have a wonderful summer. Take care.